Dear viewers, have you witnessed a situation where there's a family in which most of the cases the man is abusing alcohol or drugs of addiction, particularly alcohol or mirror, and they're having problems, these men, with their wives. There's problem in the family because of this addiction. And one of the things that stands out is that the man is accusing his wife of being unfaithful. And when you look at the family as maybe extended family members or neighbors, you really don't see the evidence that the wife to this man is unfaithful. But the man has a deep belief that the wife is unfaithful, and this causes strife in the family, among other things that cause strife in that family because of addiction. This is what I want to talk about today. Welcome to our channel, Dr. BMS, where we discuss societal issues, health issues that affect our lives as individuals, families, and communities. So, you've seen these cases. We receive them in our Center Fountain of Hope when patients are checked in for rehabilitation, particularly the males. And this is common, as I said, in people who are using alcohol, mirror, and even other drugs of addiction, but these ones really stand out. And during rehabilitation, there's a section of rehabilitation called family therapy, where we call family members to come in and have meetings, therapeutic healing meetings with the person who is in rehabilitation, so that they mend the broken fences. Because part of manifestation of addiction is that you break trust, you break relationships through your behavior. You are irresponsible, you squander money, sometimes you are violent, you miss out on obligations, responsibilities. So it's like you abandon your family and you fritter away the resources. This causes a lot of discord between couples, between parents and their children, and even between siblings and the extended family. So during rehabilitation, as we are healing the person who is in addiction, we also want to heal the other family members who have been negatively affected by the addictive behavior of the person who is in rehabilitation. And this is done through what is called family therapy. So it's in family therapy that we get this issue that I've mentioned, where the man, typically is a man who is in rehabilitation for addiction treatment, accuses his wife that she's unfaithful, and in some cases says or declares that this is in fact the reason why they have been abusing drugs. And we investigate this further, we interrogate the wife, the other family members come in to help us, and the evidence we get in some cases is that this is not true at all. But this man believes it firmly that it is there. We have this case described in our work away from addiction, and it even has a name. It is a psychological problem. Sometimes it can be a psychiatric problem, where you have got abnormal beliefs, wrong beliefs about things, and other people around you don't see those beliefs as grounded in reality, but you believe them yourself. Medically, we call those delusions. We call those hallucinations. We call those obsessions. You may have heard these terminologies being mentioned with patients. And generally, they refer to a situation where you have lost, the person who they are being used to refer to has lost touch with the reality, and so they may believe some things that are not there to be true, but they are not true. Those are delusions. Or they may see or hear or perceive, feel things that are not there, as if they are real, but they are not real. And those are called hallucinations, okay? And they may act in certain ways driven by these wrong beliefs, by these delusions and hallucinations. They may act in certain ways and have a rigid way, sometimes a repetitive way of acting or reacting to these situations. And we call these obsessions, okay? So patients who have delusions of infidelity around their partners and they are in addiction, there's a terminology that is used called Othello Syndrome. Othello Syndrome is broad. It's not only in alcoholism or drug abuse, but generally is a situation where someone is having delusional beliefs about infidelity of their partner. So in drug addiction, alcoholism and drug addiction, we get episodes of Othello Syndrome, and it's interesting to discuss this and to interrogate this, because you want to think that, is it the alcohol that made this person start to think abnormally that way? Or is there something else? And in our investigations, in our observations, we have found that it seems to cut both ways. That yes, these drugs of addiction are interfering with your mental functioning, so they cause a decline of mental functioning on a general scale. And that means then that you may start perceiving or believing in things that are not true. So delusions can start, hallucinations can start, okay? Sometimes these drugs of addiction cause outright mental illness, which we call drug-induced psychosis, mental breakdown because of using too much drugs. It can be acute, like it just happens suddenly and lasts a short period of time. So you use drugs and then you act like you're mad for some time. Or it can be slow, progressive, and irreversible even sometimes, the chronic types. So yes, this dimension that drugs, alcohol are causing you to become delusional and to accuse your spouse of being unfaithful when that's not grounded in reality is there. But there's another dimension that we have observed, especially when we talk to the wives of these men. We go back in time, we ask about the sexual history in relation to these accusations. And the wives will tell us, yeah, actually it is true that my husband has not been performing, he's not been sexually active for some time. And I can see a pattern where as the alcoholism or the usage of Mira got severe, so the decline of their ability to perform. And at the same time, the increase in the suspicion that I was unfaithful. And this then leads us to see like, could it be that this person, knowing that they are not able to perform and feeling uncomfortable about their inability to perform, now starts suspecting their spouse because they feel some kind of guilt, some kind of deficiency, some kind of void, their inability to perform, they start thinking that because I'm not able to fill this void to perform, so therefore there must be someone who is doing it, because I think probably my spouse cannot just accept, stay like that, or continue with their life even when I'm not performing without requiring that performance. And so they must be outsourcing it. That's why they never talk about it. They don't cause trouble about it, Because in most cases, when this sexual performance declines, most of the cases, especially the wives, will kind of just let it go. Let it go, and it's not a big issue for them, okay? They focus on the bigger problem, which is the alcoholism, the drug abuse, the dysfunctionality in the family. They're having to take up the extra responsibility because their husbands now are not there in terms of performance, just physically, but not taking up their responsibility. So the extra responsibilities that the wives have to take care of preoccupies them to a point where they forget about the sexual aspect. They become asexual, okay? They become nuns of sorts. And so life then moves on. They are busy with other things. But this man, on the other hand, his conscience is knowing he would wish to perform but cannot. And so when he sees his wife is just seeming to continue with her chores, probably complaining about school fees not paid, maybe rent, food, and whatever. So, but why is she not concerned about this? I think she must be doing it somewhere else. And then what was a suspicion gains ground because your head, your brain is not functioning well because of the drugs, because of the alcohol. And now we have a situation where your inability to perform causes you to be uncomfortable, to feel guilty, to feel inadequate, and that then raises a suspicion that this then must mean that someone is doing something else to compensate or maybe to punish me or to just get by. And so we have this syndrome, the Othello Syndrome, the suspicion of infidelity without proof, happening from both sides, that your brain is deteriorating, and so your reasoning is not okay, and you're starting to become suspicious of things, to become delusional about things. But at the same time, your very inability to do this function primarily is making you uncomfortable in your skin, and you're starting to look for excuses for people to blame, including your wife. That is because she's unfaithful, that's why maybe I'm not performing. And we hear a lot of that when we have this family therapy session. So, an interesting point there, something for you to ponder as you look at these families that have got one of their own abusing alcohol to a point where you feel they need help, and sometimes they're having discord, and you as family members or friends, you are being called in maybe to solve a case or an accusation of infidelity. Just think about it. Dr. BMS mentioned it. Could it be because this man, who I know drinks a lot, and today now he has come to accuse his wife, our sister-in-law, our neighbor, that she's unfaithful? Could it just be a manifestation of that syndrome that was mentioned? And if you think that that is, then that is more reason that this man requires rehabilitation from addiction. Bring him up to us, call us Fountain of Hope and other rehabilitation specialists that can help you, so that we help this person, we save this family, we bring up this issue in family therapy, and usually by that time the person is recovering in rehabilitation and he's feeling his masculine power starting to return, and we encourage them, we give them some medication, we give them counseling. Specific techniques of counseling are available to treat these misconceptions, these delusions, these suspicions, and we get this family healed from the person with the addiction to the marriage and the wider family. See you again in another video of Dr. BMS, and if this message resonated well with you, please remember to subscribe to our channel, make it grow, share this video with a family that can benefit from today's message. Thank you.